Hi guys, my name is Dr. Dave. I'm a chiropractic physician, rehab specialist, and founder of OnlineSpine.ai, where we help people fix spine pain from home using personalized AI-guided rehab programs. I've worked with thousands of patients, and I can tell you this with certainty. Pain is never just bad luck. Something happened. It might be a series of things, but something actually did happen. There's always a cause, and there's always a reason why you have pain. And traditionally with spine, there's usually more than just one. Let's get into this. Let me break it down for you. Probably the number one cause of pain is what we call disc dysfunction. The spinal disc is a kind of a tire with a jelly donut. It's got a strong outside called the nucleus fibrosus, and you have jelly-like material on the inside called the nucleus pulposus. Now the stuff on the outside acts like a ligament. It connects two bones, so the two vertebrae trap the disc in between, and it's used as a shock absorber. The fibers of the disc attach to the bone just like a ligament, so it is a ligament. And the outside of that disc is actually filled with nerve endings. And the number one nerve ending is pain receptors. When you injure or stretch out like a bulge of that disc material, you're going to have a lot of pain. But let's start with the worst situation that most people worry about, which is disc herniation. Now remember, discs are shock absorbers between the vertebrae, so they squish, 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 right? So they don't slam the bones together. Typically they have an outer layer, which we talk about annulus fibrosus, and an inner gel-like material called the nucleus pulposus. In normal language, like we said, it's like a tire. You have a tire with a hard outside with a jelly in the middle. The disc itself loses hydration, movement, or load tolerance. That jelly or that disc starts to push out. That's called a bulge. And if you tear on the outside and that disc continues to push out, that results into a herniation. Typically a bulge moves into a herniation. Here's the problem with what most people never hear. Most disc problems actually heal. Not all herniated discs need surgery. There are many of us actually that walk around with herniated discs and don't even know it. Because you tweaked or injured your back, it tore a little bit, you had a little herniation, and it sits there for the rest of your life. In fact, there was a study done not long ago where they examined many people, and they grouped them in groups by age. And what they found is anybody under the age of 60 typically has one herniated disc in their spine in their 50s. When you get to 65 or older, typically we'll find two herniated discs in the spine. And again, there's no symptoms, there's no pain, there's no ongoing agony. Just because you have a herniated disc doesn't mean you're going to have pain, believe it or not. But when you do start having the pain with that herniated disc, that's when we need to figure out why. Because that means the issue is still going on. Pain from disc usually comes from irritation and inflammation. There's usually no permanent damage. But if it continues to get irritated, it's going to cause more pain. Also, discs need to move regularly, and they need to do that to stay healthy. That's why sitting today creates so many disc injuries or disc issues. It's because you're sitting in one area with full load on the spine with no motion. They don't have blood supply like we do with our muscles and the rest of our body. They rely on that compression distraction as we stand up, lay down, sit down, and constantly move. They rely on that motion to pull in the fluid and the nutrients within the disc to keep it healthy. When someone stops moving, it's because of fear, the disc actually gets worse. That's why bed rest has been eliminated for most back issues. Now I say most because there are some instances where you need to really be careful. Disc pain doesn't mean your back is broken. It means it needs the right movement. If we can get that movement, typically discs heal very well, and they do very well. They're very resilient that way.